Okay, so we are now recording. Again, join without video, mute your audio so there's no feedback. Go ahead and ask questions in the chat if you would like, but please don't share sensitive information. We do have a trigger warning. There's a very brief discussion of self-harm and suicide, as that is a part of depression. So feel free. We will have another trigger warning right before that discussion starts. So if you are, sorry, hang on. Annotation request. I don't even know what an annotation request is, to be honest. I don't think we've had to do that before. I'm going to go ahead and decline it. That way it doesn't mess with anything. This is being recorded, so it will be put up on YouTube for later on. But yeah, so there will be another trigger warning before we discuss self-harm and suicide, and you can log out at that time if you need to. Let's go ahead and move on. All right, so quick disclaimer. These webinar sessions are hosted by me. I'm Rachel Lindberg. I am a Master's of Counseling Psychology practicum student, and Ashley McLeaf, she is a Master's of Social Work Fieldwork student. We are both supervised by Mark Ream. He is a licensed professional counselor and the director of Angeles State's Counseling Services. These webinars are informational and psychoeducational in nature, so they are not intended to be used as psychotherapeutic treatment, meaning please don't share any sensitive information in the chat, and we cannot provide therapy during these webinars. But should these sessions cause psychological or emotional discomfort, please call ASU's Counseling Services at 325-942-2371 or the crisis helpline at 325-486-6345 for immediate assistance. Let's see here. I'm going to go ahead and mute a couple of the call-in users. Sorry, but there's some feedback. So, okay. Alrighty. Sorry about that. Moving on. Okay, so I'll go ahead and let Ashley introduce herself real quick.
Hi, thank you guys for all joining in. We have like a bunch of people this week, so that's super awesome. I'm Ashley McLeaf. I am a social work advanced standing graduate field student. Here at the Counseling Center, I conduct intake assessments and provide case management services to students. And then after graduation, I'm going to seek licensure as a licensed master social worker. And then a little fun fact about me is I listen to about 10 different podcasts, probably more. That's a good way for me to kind of decompress, and it's one of my big self-care things that I like to do for myself.
Yeah, that's fun. Like I said earlier, I'm Rachel. I am the Counseling Psychology graduate practicum student. Here at Counseling Services, I do intake assessments, and I can also provide individual, couples, and group counseling. After I graduate, I will seek licensure as a licensed professional counselor intern. And then my fun fact, I share a birthday with one of my dogs. Probably my favorite fun fact about myself. All right, so let's get moving. We are talking about depression today. Again, a little bit of a trigger warning. There's some discussion of self-harm and suicide. This topic, we haven't covered any like specific diagnoses for these webinars, but this one is just probably the most prevalent mental health condition. So we definitely wanted to talk about it. It's not something to be ashamed of, definitely something to be aware of and kind of know, be aware of how you're feeling and what you're doing so that you can get the help if you need it. So what is depression? Depression is a diagnosable mental health condition that's characterized by a depressed mood and loss of pleasure in activities previously found enjoyable. It is more severe and long-lasting than normal sadness as an emotional response to a common daily stressor. So emotions are fleeting, they can last for 5 seconds, 5 minutes, 10 minutes, whatever, but depression has to last for 2 weeks or more. So there's a big difference between, our emotions fluctuating and having a persistent depressed mood. Depression also impairs functioning in your daily life. It can affect how you function at work, at school, with your family and other relationships, whether that be romantic, with friends, your coworkers and boss, things like that. Symptoms can vary mildly. So, mostly symptoms are pretty set in how it displays, but like from person to person, someone may show one symptom and another person might not show that same symptom. And they can also differ slightly between ages and genders. There are some differences between how people of different ages and genders display depression. Depression does require a mental health or healthcare clinician, like a family doctor, to formally diagnose. So we really advise against doing self-diagnosis. It's one thing to be aware of some symptoms you might be experiencing and consider, going to get checked out versus, diagnosing yourself without having a mental health clinician do it. So because it requires a diagnosis in order to say, like, I have major depressive disorder or another depressive disorder, it does require that certain diagnostic criteria be met before a diagnosis can be made. So just experiencing one symptom doesn't necessarily mean that you are depressed. Who is affected by depression? Anybody. Anybody can be affected by depression. It's not just angsty teenagers or emotional teenagers. It's not just people who are going through a divorce or maybe are having a rough time in their life. Anybody from all ages, genders, races, and ethnicities can experience depression. 17.3 million, which is about 7.1% of Americans, have experienced at least one depressive episode in their life. So, just because you have experienced a depressive episode once in your life doesn't necessarily mean that you will always have depression for the rest of your life. It can kind of go into remission of sorts, if you want to use that word, and that you might be susceptible to it again in the future, but it's not for sure that you will have it again. I think that's really important to make the distinction for prevalence is higher in females, about 8.7% versus in males, which is about 5.3%. There's a lot of research about why this may be, and the common thread among it is that women are more willing to not only talk about their feelings, which is like the kind of cheesy way to talk about it, but women are more likely to report emotional problems within healthcare settings than men are. And men are less likely to display depression in that it looks like sadness. I'm going to talk about that a little bit more later. So a male who is presenting with different symptoms that might not be recognized as depression, it might be recognized as something else like anger. And so that's kind of why there's some disparity in there. And also males experience a little bit more stigma about going to see a mental health counselor. So they might not report those kinds of emotions. So the prevalence among adults is the highest in ages 18 to 25. So that is the college age group, the young adult age group. I understand not everybody in this age group is in college. So really just emerging young adults, really. That's 13.1%. So yeah, the prevalence is highest in adults who identify as one or more races. 11.3% with American, Indian, and Alaska Natives being second with 8%, and white Americans being third at 7.9%. So very important to recognize that, Black indigenous people of color are experiencing depression at higher rates than Caucasian individuals. And so I just really wanted to point that out because, their mental health is just as important. And that seems to be a common or very salient issue right now with our current political climate. 64% of adults who have had a major depressive episode reported severe impairment to their daily life functions and activities. So this is super important because over half of these adults who are experiencing depression are experiencing some sort of impairment to their functioning, which is why it's so important to seek help for these issues. So I just really wanted to point that out. Some risk factors. Risk factors for depression. So these are factors that may make an individual a little bit more susceptible to depression, but it does not mean that because you have one or even all of these risk factors that you will have depression. So really wanted to point that out. So loneliness and isolation, relationship or marital problems, recent stress, stressful life experiences such as unemployment, bereavement, which is grief, financial problems, things like that, childhood trauma, family or individual prior personal history of depression, personality traits such as worrying excessively, having a negative outlook on life, being highly self-critical or low self-esteem. Even those can factor in. Did those actually definitely factor into our mood, especially if we're not being very nice to ourselves. Early childhood trauma or abuse. So not just trauma, but also abuse, and then alcohol or drug abuse. So using substances can also, alcohol is a depressant. Alcohol makes us feel depressed once the fun effects wear off. So that is very important to know as well. So these are the signs and symptoms that are the specific criteria that needs to be met in order for a diagnosis to be made. So that's 5 or more of these symptoms have to be present for at least 2 weeks with either 1, depressed mood, and or it could be both, but there has to be at least 1. 2, loss of interest in activities previously found enjoyable. So this is when we find ourselves not participating in our hobbies, not going to the job that we liked, not wanting to spend time with friends and family, those kinds of things. So 5 or more of these symptoms have to be met in addition to either 1 or 2. So that's weight loss that's not attributed to a specific diet or weight gain, insomnia or hypersomnia, which is sleeping too much, slowing of movement, so moving a little bit slower. It's, you might be walking kind of with your head down. Might appear to other people that you're lazy because you're moving slow. Fatigue or loss of energy, feelings of worthlessness or inappropriate guilt, not really knowing. Usually guilt is saying that you made a mistake and it might have hurt somebody else, so you feel guilty about that. But in this instance, it would be guilt without having a reason why. Diminished ability to concentrate or indecisiveness, recurrent thoughts of death, suicidal ideation without a specific plan, thoughts of self-harm or a suicide attempt, clinically significant distress or impairment in occupational, academic, and social functioning. It's not attributable to substance use or another mental health or medical condition. And there's no presence of a manic or hypomanic episode, which would be with bipolar disorder. Not going to go in super into depth, but with bipolar disorder, there's the presence of manic and depressive episodes. So if someone is experiencing both rather than just depressive episodes, they would need to be evaluated for bipolar disorder over depression. So yeah. Depression versus anxiety. Sometimes people use them interchangeably, or they think that you are always diagnosed with both, but that's not always the case. Individuals can experience depression and anxiety at the same time. 50% of individuals with depression also meet the diagnostic criteria for anxiety, but they are not the same thing. They have some of the same treatments, like the same kind of medications can be used to treat both, but doesn't mean that they are the same thing. Anxiety is usually a response to worry, stress, and apprehension, plus like restlessness, like being kind of on edge about future events. So that future events is the important distinction. Depression tends to be a response of hopelessness and helplessness for the future or the current situation, plus slower motor movement. So they're kind of opposite in how they affect our bodies, as well as usually depressed individuals, they're usually pretty apathetic about the future. They don't care about the future. They aren't concerned about what's going to happen to them in the future. They feel hopeless about the future rather than feeling nervous about the future. And with symptom overlap, there are some symptoms that overlap, such as fatigue, sleep disturbance, trouble concentrating, irritability. But anxiety doesn't normally present with like a depressed mood. Usually they're more keyed up or on edge rather than sad. But I just want to be clear, they can occur at the same time, but they do require separate diagnoses. So depression, sadness, and grief. This is another important distinction to make. They are three different things, although they can be all interrelated, but they are not interchangeable. Depression doesn't always have a direct cause, but it is influenced by situational, personality, and environmental factors. So, as we talked about a minute ago, it must last for at least 2 weeks or more to meet the diagnostic criteria. It's cyclical in that you can experience it for 2 weeks, feel fine or better for a little bit, and then go another 2 weeks having a depressive episode. And then it's characterized by, the loss of interest in pleasurable activities and feelings of low self-worth, which is usually maintained. Usually not maintained, sorry, that's when experiencing sadness or grief. Usually when we're going through grief, we don't lose how we feel about ourselves. If your self-esteem is pretty high beforehand and somebody passes away, that doesn't change, but it is changed with depression. So grief is a direct response to a loss, whether that be the death of a loved one, a pet, loss of a marriage or relationship, job, opportunity, those kinds of things. Grief is often experienced in waves with both feelings of intense sadness and happy memories of the past, and it can resolve as time goes on. So even though it is experienced kind of in waves, doesn't make it like cyclical. Like you might feel grief one day, but it won't last for a full 2 weeks. It'll be for a day or two, and then you'll feel a little bit better, reminiscing about the happy times that you had with that person or opportunity or whatever it was. And it will resolve as time goes on. And grief doesn't normally require the use of medication for treatment. I think that's also important. And sadness is an emotion that does not persist for as long as a depressed mood. We might feel sad when we see something that makes us want to cry. We're watching a movie, but once we're done with that, our emotions change. Our emotions change all the time. It doesn't necessarily mean it's a mood swing exactly, but our emotions can go from being sad while we're watching, the first 5 to 10 minutes of Up, and then we're happy for the rest of the movie. So, it changes because it's situational in nature, and we also have those moments of happiness, contentment, calm, anger, disgust, and usually with depression, mood that's really kind of it's depressed. So yeah. So this is our third trigger warning. Right after this, we are going to be on the next slide. We're going to be discussing self-harm and suicide. If you need help because of these topics, or you need immediate help right now, call counseling services. That's 325-942-2371. The crisis helpline, which is available 24/7. That's 325-486-6345. Or if you need immediate, like right now assistance, call 911, please. But yes, that's our warning. So if you would like to leave right now, go ahead and do so. Because we're going to talk about these sensitive things.
Yes, and I also want to remind everyone to be mindful about if you put anything in a chat box, making sure that it is something that you would want to be shared, because these sessions are recorded and posted to our YouTube channel, and just making sure that don't really share like personal private information. But please feel free to ask questions and interact with us, of course. Okay, so depression and suicide risk. So depression is a major risk factor of suicide. So it's often related to very intense feelings of hopelessness, helplessness, and worthlessness. So to the depressed individual, suicide may feel like the only option to escape the pain that they are feeling at that moment. And they may not be able to focus on anything else but that intense feeling. So some common warning signs of potential suicide risk are talking about killing or harming oneself, expressing strong feelings of hopelessness, Unusual preoccupation with death or dying, reckless actions like reckless driving, being in like practicing reckless behaviors, calling or visiting people to say goodbye, telling people like goodbye, getting affairs in order. One of the things that we always talk about is people giving away a bunch of their things. So that kind of goes along with getting your affairs in order, of getting rid of a lot of belongings that hold value and were very important to the individual. A sudden switch from a depressed mood to appearing calm or even happy. This is an important one because you might look at that and think, oh, they are getting better, they're doing okay, whenever it is a very big warning of a suicide risk. And then using phrases such as, everything would be better without me. So maybe not expressing explicit statements of wanting to kill themselves or harm themselves, but a more passive statement of like, I don't want to be here anymore, or everything would be better without me, these kind of things. And now some differences between gender and age. So men tend to complain more about physical symptoms such as fatigue, irritability, sleep problems, loss of interest in hobbies, and may display anger or irritability over sadness. So it's a lot more of the physical complaints rather than emotional complaints. And then women report more of the weight gain, feelings of guilt, overeating, excessive sleeping, hormones during pregnancy, after childbirth, and during menopause may also play a role. There are distinct differences in postpartum depression and regular depression. Postpartum depression symptoms tend to be a lot more severe than regular depression. And so it's always, if you're feeling this way, if you are possibly having some symptoms, it's always important to reach out to a mental health professional or a physical health professional. And of course, these are what we call typicals. This is not to say that men do not experience these other symptoms and women do not experience the physical symptoms by any means. And then, so with age groups, so teens and younger individuals tend to display more irritability, anger, agitation, headaches, and stomach aches instead of sadness. So kind of moody symptoms and physical symptoms rather than the emotional symptoms that they display. And then also you have to think about kind of teens, they're kind of learning about emotions still, they're kind of still figuring out their body, everything is still changing pretty rapidly, so may not have the words or the vocabulary to say what they are actually experiencing. And then older adults tend to complain more of physical symptoms as well, such as aches and pains, fatigue, memory problems, and they may be more neglectful of physical appearance and or stop taking medications that are essential to their health. So depression, I know that Rachel talked about this in the beginning, but we think about it as like a teen or someone who's going through a divorce, but it also does affect older adults and individuals of all ages. So there's no discriminatory factor in depression. And then some treatment options. So knowing the possible causes of depression can help determine and guide treatment. So if depression due to your job, if you're not happy, you're not satisfied at work, and that is causing extended depression feelings, then you may want to think about a career change or counseling to cope with those conditions rather than taking medications. So this is also called situation modification. So if you can do something to change your situation rather than changing yourself, then that can also help have a huge impact on your mental health functioning. And then counseling. Of course, we're advocates for counseling up here at the Counseling Center. So they can help you process your emotions, utilize tools for effective coping, and to help change some negative thinking, emotions, behaviors related to depressed moods. So, sorry. So counseling is a great option to kind of process through what's been going on. So if there is an external cause or external factor that kind of led to these feelings, you can kind of work through that. And then also your internal processes. So a lot of depressed symptoms are involve like negative self-talk and these negative catastrophic thinking. So counseling is a great resource to be able to kind of understand and process through that and learn how to cope with these things and kind of change what's going on in your brain. And then medication is also an option. So for a medication, you must be assessed and prescribed by a licensed physician, such as a family doctor or a psychiatrist. So a psychiatrist is a little bit different from a psychologist or a social worker. They actually they go through medical school as well, and they are able to prescribe medications. So medications do not cure depression and are usually for mood stabilization rather than long-term treatment. Medications typically treat the physical symptoms and help ease the physical symptoms. So the most common modality for treatment is a combination of counseling and medication. So that the counseling you can go through and talk through your cognitive functioning, how your thought processes are, and then medication can help kind of with your physical symptoms. And then in extreme, very, very extreme cases, they still do use ECT therapy, which is electroconvulsive therapy. It is not like you see in the movies with the two balls with the cloth on them that they shock people with. Electroconvulsive therapy is used in very extreme cases for severe major depression when no other method of treatment is effective. So counseling and medications are not effective. ECT is an option, and there are several different modalities of ECT. There is like an implant that you can get like into your skull, and there are also monitored treatments that you can undergo that are done under anesthesia, so you're not awake for it. And then also I just wanted to talk about with medications, there are several different types of medications, and within each type of medication there are several different options. So it can take a long time for medications to kind of find the right one for you. Everyone is different, everyone has different needs. So finding the right medication at the right dosage can be a long process. There are different types of SSRIs and then other different classifications of medications. SSRIs are what we hear about the most. That's what typically is currently used for most depressive symptoms management. But medications, and then, sorry, thought process. And medications also can take 2 to 6 weeks to start showing full effects. So it can be a very long, drawn-out process to find the appropriate medication at the appropriate dosage for your body. Okay, so some other ways to cope with depression. So these are some things that are kind of you can do practice in your life, even if you may not feel like chronic depression of like diagnosable depression. If you do have depressive feelings or symptoms, these are also some great things that you can do. So reducing isolation by spending time with family, friends, coworkers, of course, virtually or at a safe distance right now, keeping in mind your personal health and well-being. During COVID-19, we are still seeing a spike right now. So. And then exercise. So you don't need to spend hours at the gym. A short walk or playing with your pet is a great start. Exercise, kind of getting your body moving, is a good way to kind of get out some feelings. And then, so eating a healthy diet is also another great option of a way to cope with depression and depressive feelings. Making sure that our body is well nourished so that our brain can function effectively. And then engaging in healthy coping activities such as volunteering, doing a hobby, being creative, gardening, self-care activities, all of these things that we talk about as like healthy coping strategies. We do have a little worksheet on healthy coping strategies in a minute, I believe. And then also in a couple of weeks, we are doing another webinar about personal values and how to integrate those into your life. And that is a great way to kind of achieve this as well. And then practicing mindfulness. So mindfulness meditation is an awesome thing to practice in your life. So it can help relax your body and it brings you into the present moment. So whenever we talk about depressive feelings and catastrophic thinking and hyper focusing on one specific thing, mindfulness is a great tool to be able to practice to kind of just bring yourself back into what's going on right now, and then also different grounding techniques and things like that. So that's an awesome thing. And there are several different apps that you can utilize on your smartphone or the internet or YouTube videos or anything. I do have a little worksheet in a second about kind of how to start practicing mindfulness. So those are some awesome little coping strategies. So some resources for depression. So you have a depression info sheet, and we're going to copy all of these links into the chat box so that you can save them if you would like to have them. So at the top of this sheet is some symptoms of a depressive episode. So depressive mood, sleep difficulties, loss of interest or pleasure, diminished concentration, things like this, some demographics, some risks, factors, and then the differences in psychotherapy and medication options. So again, it goes over CBT, which is kind of going through your thought processes. And then on the medication side, it does also highlight that they do not work overnight, but they can take 6 weeks to reach full effect. And then some other facts about it. And then supporting someone with depression. This is an awesome resource for just to have. If you feel like one of your friends might be suffering from some depressive feelings, depression, this is a great little worksheet to kind of work through how to support your friend. So listening to them, encouraging them to receive professional help, connect them with some more social support. If definitely taking any mention of suicide seriously. I know a lot of the times people use it as a humor modality, like they talk about it in like a joking manner, but making sure that you check in with them and make sure that they are doing okay. And then always, if you feel like your friend is in immediate danger, if they have stated their intentions to attempt suicide, if you feel like their life is in danger, call 911. Do not hesitate. You can also take them to an emergency room or contact a national suicide prevention line. But if you feel like their life is in immediate danger, contact 911 so that the appropriate authorities can come and help. And then this is a little video of what is depression.
Sorry.
No, it's okay.
I'm trying
We
to
still can't
pause
hear
it.
Yeah.
Yeah, I wasn't gonna play it. I was just gonna put it in the chat box.
Yes.
You can hear it.
This is an awesome little video about understanding depression. It won't play the sound on here for you guys, or we would play it for you, but it's just a short little, it's under 4 minutes. So it's an awesome little video to go and check out, and it's like animated, kind of cute, so it's a fun time. And then this is that healthy and unhealthy coping strategies little worksheet. So those unhealthy coping strategies of like drug or alcohol use, overeating, procrastination, sleeping too much or too little, and then versus the healthy coping strategies of exercising, being able to open up and talk about your problems, healthy eating, and practicing relaxation techniques. And then some example scenarios of these things. And then it also has a little worksheet of how to like work through what your coping strategies are. So what are your healthy coping strategies? How can you change that up in your life? And then this decatastrophizing worksheet. This is an awesome little aid worksheet thing to go through. So it goes through what cognitive distortions are. So it is totally normal to catastrophize things and to have these cognitive distortions, but they can get to the point of being harmful and being impactful to your health. And so this kind of goes through, what are you worried about? How likely is that is going to come true? What's the worst thing that could actually happen? So oftentimes people are like, oh, don't think of the worst case scenario, but it can actually be beneficial to outline what the real worst thing that could happen is. Because instead of it being like, oh my gosh, everything could go wrong, and just kind of catastrophizing and building up that snowball rolling down the hill, you get to actually look at, okay, what is really going to be the worst thing to happen? And then what is the most likely thing going to happen? And then also it at the bottom outlines, if your worry does come true, what are the chances that you're going to be okay? Are you going to be okay in a week? Are you going to be okay in a month? Are you going to be okay in a year? So this is an awesome little worksheet to utilize. And then practicing mindfulness meditation. This is a little worksheet, or not worksheet, but a little guide on how to start practicing mindfulness meditation. So it outlines that it's a present moment, and then time and place where you can practice this, posture of how you should be sitting, and then how to breathe, and then whenever your mind wanders, how to kind of walk yourself back to what you're doing, and then being open and not being too hard on yourself. So this is an awesome little worksheet as well. All right, and then we have some support services for depression. Most of these are going to be kind of local to the San Angelo area, but there's also some national and online resources. So of course, the ASU Counseling Services, you can contact us at 325-942-2371. We are here to help you guys. We are still operating. Right now, we are still doing teletherapy, but pretty soon we are going to be moving to allowing students to come in for counseling services. And then also the ASU Crisis Helpline is available 24/7. So if you are having intense feelings of depression, or you feel like you are in crisis, or a friend you can contact our crisis helpline at 325-486-6345. And then the National Suicide Prevention Line, which is 1-800-273-8255. I did see something in the news that the suicide prevention line was getting a 3-digit number, I believe.
2 more years.
Yeah,
It'll be
2 more years. So you hold on to this long number, and then in 2 years, I think it was going to be like 988 or something like that. So it'd be similar to being as easy as calling 911. And then also there is a COVID-19 mental health support line. So if you're feeling intense sense of anxiety or depression or mental health crisis due to COVID-19, then you can contact them at 833-986-1919. And then MHMR Services, they have their MCOT team, or their Mobile Crisis Outreach Intervention team. And they are available at 325-653-5933. And then also, if you're not local, or if you wanted a community provider, psychologytoday.com is a database of counselors in your local area. So you can filter by insurance, specialty, gender of the counselor, whatever you would like, to really find a counselor that you are going to click with and be able to open up to. So that's an awesome resource just to have in your back pocket. And then, of course, our little resource sheet. So we went over the National Suicide Prevention Lifeline. There's also the Trevor Lifeline for LGBT youth, which is 866-488-7386, and the National Sexual Assault Hotline, which is 1-800-656-4673, and then the Veterans Crisis Line, which is 800-273-8255, and then press 1. And then there are a couple text lines, and the ASU crisis line, the ASU police department, and then our ASU counseling services number where you can reach us. And then also there are different resources available all over the internet. So utilizing the therapist Psych Hub, or Therapy Assistance Online, TAO, and YouTube has an awesome wide variety of all sorts of resources. Okay, so our question and answer portion, you can ask any questions that you would like. Also being mindful of personal information and everything. These are recorded sessions. And then we can circle back to your question. So, So dealing with a roommate can be a very difficult situation, especially in college, if it's someone that you do not necessarily know. An important thing is whenever you move in to kind of set up expectations of kind of making sure that living spaces that are common are tidy, or they pick up after themselves, or whatever kind of rules you would like to put in place, and then making sure that both of you have a open dialogue. But if that is already there, it's always good to kind of revisit and maybe set up some rules, if that's applicable. Yeah, so just maybe like opening up and having a dialogue with them. Hey, I don't really enjoy it when you do this. I don't really enjoy it when you leave the dishes out, or things like that. Does that make sense?
Any other questions?
That's a great question. probably one of the best things to do is ask them what they need. Just what do you need in this moment? If you need to be alone right now, if you need for someone to be across the room or next to you. Because whenever everyone experiences different emotions differently, everyone experiences depression in a unique way. And so just asking them what they need is probably going to be one of the best things to do. Welcome.
All right, that's it. I think we'll go ahead and close this out for the day. And we really appreciate y'all coming in and listening. Again, this was recorded, so it'll be put on YouTube as well on the Counseling Services YouTube page. And we hope that y'all have a good rest of your week. And go ahead and give us a call if you need us, okay?
Yes, and thank you guys for tuning in. And next week, we're going to be talking about positive psychology, so tune in for that one as well. And thank you guys.